Couldn't make it, but want to catch the replay. Thanks for joining me. I really am excited to get back into the rhythm of doing classes. I love to teach, and it's something that obviously through the pandemic kind of fell to the wayside and for various reasons, but yeah, so stay tuned for more classes. If you have specific classes that you want more information about, please let me know. My goal is to do these sort of courses, kind of a mix between in-person and online, just seeing what is most accessible for people. But my goal is to do them at least once every other month, if not ideally even once a month for the foreseeable future, if it's going to be a success and helpful for you guys. So I'm going to, Melody, I'm going to start actually first, and then I'm going to have you, then I'll have you jump on. So let's see here. Share my screen. All right. Can you guys? Okay. Can you guys see me okay? You see me at all? Cool. Okay. I'm just gonna roll with it for now. Zoom. Gotta love it. All right, guys. So give me a second here. Bear with me. I'm rusty since I haven't done this for a while. All right, here we go. So we are going to really try and educate about sexual health, how to kind of reignite that flame for you guys in the bedroom and you and your partner. A little bit about myself. My name is Dr. Chelsea Beyers. I am a pelvic health expert. I've been in pelvic floor therapy for a little over 13 years now. I own Treasure Valley Pelvic Health here in Eagle. And over the past 6 years, I've incorporated energy medicine into my practice as well. I have 3 littles that keep me busy and on my toes amongst other things. Like I said earlier, I love to teach people and I'm a lifelong learner. I'm also a founding board member for the Idaho Sexual Health Professionals here in the state, and Cami's a part of that as well. So we might talk a little bit about that at the end. All right, so the basic goals for today that I really want to cover is those anatomy basics, getting a good understanding of the arousal cycle, the erogenous zones of the body. A lot of people are aware of some of the most common ones, but I wanted to just glean over and get a better understanding of what more others are and what works for you versus your friends or other people that you know. Orgasm, how to achieve it, hopefully a little bit easier, common problems that I see here in the clinic, the role of physical therapy for sex, of course, I can't ignore that piece. And then of course, the ultimate goal is the tips for better sex, right? All right, so diving right in, the thing that I love about the genitals is a lot of people get hung up about what it looks like, or you know, that they're different, or it's not what they expect, right? But really, the vulva and the penis is so unique to the individual. It's just like a fingerprint. And this can be a little frustrating for some people, but because of social portrayal through various things that you know, like the inner lip should be symmetrical, and that shouldn't smell or anything like that, right? but it is so unique to the individual. And I always like to remind people too that the skin on our face changes through a lifetime. So we can only expect the skin of this area to change as well, but it changes um, a lot of times, often even with a pregnancy, not just a vaginal birth, that can change it more notably, but just a pregnancy and the changes in the hormones and everything can change the length of the tissue of the labia minora or majora even. So just appreciating the differences and embracing it. This is a great piece of art. I believe it's in the New York area. But it's the Great Wall of Vaginas was the original piece, and then they moved on to the Great Wall of Penises, and it's much larger than this. It's quite a large display. So if you're ever out and about touring art exhibits, try and find this one. It'll be an enjoyable view. So the pelvic floor muscles, I really want to take a moment and appreciate the differences between the male structure and the female structure. And you can see here that, I love this little pointer here, that the pelvic floor muscles from this point on, from the between the sit bones, this line of muscle here, is the same all the way down to the tailbone for men and women. And then coming up, we have the muscle coming along that pubic bone, that pubic arch. That is even the same between men and women. And really the only difference structure-wise for the muscles is this bulbospongiosis that comes up onto the penis for men and then around the opening of the vagina for women. But other than that, it is really quite symmetrical, or not symmetrical, but similar between genders. And I find it interesting that a study done in 2014 found that over half the women aged 26 to 35 were unable to accurately identify the vagina on a picture. So I think that's important to understand that the vagina is the vaginal opening and within. The vulva, and we'll go into this a little bit more in a little bit, but the vulva is the external structure. But if we can't correctly communicate or identify structures of ourselves, how can we guide our partners to be able to identify areas and structures that are pleasurable? But also, I think it's important from a medical standpoint to be able to correctly communicate to a provider of anything that's going wrong. I also encourage patients to do a monthly check. Just take a hand mirror, look at the tissues, make sure there's any abnormal changes, abnormal growth, or anything like that. You can catch things a lot sooner if you do that. This is the second layer of muscles. I don't think I mentioned, but there are 3 layers of pelvic floor muscles. So the second layer, again, even more similar, and the only difference again is that vaginal opening now. The contours of the muscles, might change slightly based on the width of the pubic arch, as women have a little bit broader arch because of allowing for childbirth. But you can see that they are the same between genders. Apologize, this picture was a little bit blurry, but it was the best I could find right now. But this is the third layer. So again, even more so, this shows how it just shows the contour of the pelvic floor muscles within the deepest layer of the pelvis. And again, it's the same. The only difference is that presence of the vagina versus it is closed for a man. And the main functions of the pelvic floor are sphincteric control. So this is a whole nother topic for another day, but this is where bladder control, bowel control, 1 in 3 individuals will experience leakage over the course of a lifetime. Think about that. That's a lot, 1 in 3 people. So it's quite common, but it can be addressed quite easily. So something to think about. We can dive into that more later. Sexual function for the pelvic floor, it should be able to comfortably accommodate for an erect penis or a toy of any sort, and it should not be painful. And obviously, if conception was achieved, then childbirth can be allowed as well. The pelvic floor provides stability. As you can see, it is this ring of muscles that goes around the entire contour of the pelvis. And when those muscles contract, it pulls that bony structure together and provides and reinforces stability of that area. If those muscles are weak, then people might be prone to some low back pain, some hip pain, and other problems like that. So if you're struggling with that and traditional orthopedic therapy hasn't been working for you, you might consider seeking help from a physical therapist who's trained in internal pelvic floor work, because they can really dial in things a little bit more effectively sometimes. And then it also adds support. As you can see in this picture, it provides a hammock from front to back, from tailbone to pubic bone, for the pelvic organs. It's kind of like a trampoline and provides a little bit of extra support for our functional activity. And then a sump pump. So when these muscles contract, they help get that blood flow back up and out of the pelvis. And so you don't have problems such as congestion. Sometimes that can be more prominent and more uncomfortable during pregnancy because of the weight of baby and the compression of baby. But you might also experience more hemorrhoids when you don't have good muscle contraction in there as well, which is why I believe it's important to have a good orgasm frequently, is you can allow for that blood flow to get good return out of the pelvis as well. But here are the parts of the vulva. As I mentioned previously, I really want you to appreciate each of the differences that can be present between a woman. It's just like a fingerprint. They can really vary between individuals. And like I said, unfortunately, society has really imprinted upon us that it shouldn't have a smell, that they should be this perfect symmetrical contour. And so when there's variations, then individuals get really self-conscious and can be really embarrassed, and then they don't want to connect with their partners in as intimate ways. So be gentle to yourselves, I think, is the biggest part of it. But across the top here, we have the mons pubis, or the pubic bone, the prepuce, or the kind of the foreskin of the clitoris, right? The clitoris itself, and then the urethral opening where you urinate from, the vaginal opening, the posterior foreshead, or the bottom of the opening of the vagina, the anus, and then the perineum. And if during childbirth you had an episiotomy or you tear, it can really vary where that happens. It just depends on the situation. But the most common areas would be along this kind of bottom area, bottom of the opening. Again, they vary between individuals. So here is a good look of the clitoris. I think the clitoris is one of the most misunderstood structures in the female body. I believe most people really think of the clitoris as being present just right here at the glans. You see on the external portion, if you were to just look at the vulva and gently pull back at clitoral hood or the prepuce. But really, the full structure of the clitoris is this over here on the right side, where it kind of has these legs that go down towards the bottom of the opening of the vagina. And so you have to consider that when you're stimulating the clitoris. The glands of the clitoris has over 8,000 nerve endings on that tiny little spot itself. And so it's very sensitive and oftentimes doesn't like direct stimulation. But think about, what if you stimulate maybe to the side or a little bit more towards the top here? Or if you have a vibrator and you can apply some stimulation over along the legs of the opening of the clitoris rather. And so really having a better understanding of how that structure is placed within that vulva can help you maybe connect with it in different ways. You can also stimulate the clitoris from behind, which is the G spot, right? And it's this little bundle of nerve endings. It's also sometimes called the female prostate, but it's a different structure technically, but it is very close to that backside of the clitoris. So that can help stimulate the clitoris as well. So something to just be aware of, like the general presence and contour of the clitoris, I think is, like I said, so misunderstood. And I like this picture because it really clearly shows what the similarity is between the clitoris and the penis. Like I said, the glands of the clitoris is that tiny little structure that is the most visible piece of the clitoris for us. But that has just as many, if not more, nerve endings than the glands of the penis. And then you can see how you have the cavernosus body, the spongiosus body, and then the bulb and the crus. Again, so similar between genders, right? General parts of the penis. This is, of course, a circumcised penis. You have the glands of the penis at top, and then you have the neck of it, the shaft or the penis body itself, and then the base of the penis. A lot more straightforward for men, really is. And then you can see here, as with a flaccid penis, there's a lot more space and everything within the shaft of the penis. But as it becomes erect, you get more dilation, more blood flow to the area, and it gets a lot more firm and hard, obviously. Then, of course, you have the testicles and the vas deferens. If anybody's partner has had a vasectomy, then they will cut and tie the structure here and minimize any sort of transmission of semen. The prostate itself can be a point of stimulation for men, so you can connect with this externally from behind the scrotum here and massage that, or even rectally from within the rectum itself. Some men really enjoy that, and some it's just like, it's just like it varies from person to person, right? And we'll dive more into that in a minute. The largest sex organ, though, is our brain, which a lot of people don't really acknowledge and think about. They oftentimes will believe that there is this particular sequence of events that needs to be stimulated, touched upon, or aroused in order to achieve orgasm or pleasure of any sort, right? But you have to consider our biggest driver of all function in life is our brain, right? And for that, our mental state can play a huge role in our sex life. So if you're very stressed or anxious or distracted about other tasks in your day-to-day life, and you're not focused on what is going on during the experience of you connecting with your partner, it's going to be a lot harder for you to enjoy those sensations and work through the whole arousal process and be able to achieve climax if that's your goal. Practicing mindfulness and meditation can be helpful. It doesn't have to be an hour-long meditation in order for this to be successful. It can be 10 minutes a day in order to make measurable changes within the brain. But even less than that, just being mindful when you're doing various activities such as brushing your teeth, eating dinner, driving down the road. How often do you get distracted about whatever you're thinking of and realize you've just gone through your automatic path of going home when your intent was to stop at the grocery store? Same thing during sex. If we can connect and pause and slow down and really experience what those subtle sensations are, not only are you going to be able to enjoy that and have more pleasure, you might achieve orgasm that much easier, but you'll also connect with your partner that much deeper too. And mindful sex, I believe, is when you are completely and fully immersed in that physical sensation of your body, right? You can even connect with the breath pattern of your partner, and that can energetically connect you at a deeper level and enhance that mindfulness just that much more and enhance that experience. It's really fascinating how much we overlook this piece of the puzzle, but how big of a role it really plays into it. So I know women often get a lot of grief about how we are busy thinking about all of our to-do lists, but it really does come into play. So start practicing a little bit of mindfulness, trying to quiet that mind and not necessarily having any judgment with if you get distracted, but just let that thought pass by, redirect your focus, come back, focus on your breath, and like find an area where you're having sensation and just be present with it and just enjoy it. So the Sexual response cycle has 4 general phases, but it's important to know that most women won't necessarily go through all of these phases in this exact order, but some stages may even be absent. But the general phases are excitement, plateau, orgasm, and then resolution. So excitement, this is pretty straightforward. You're going to start to see a natural increase in vaginal lubrication, swelling of the clitoris, quicker breath patterns, erection will be achieved. Those blood vessels will start to relax and the smooth muscles will relax because of that nitric oxide, because of that increase in blood flow. And the better the stimulation, the better that arousal will and natural lubrication will be achieved. And that increases vaginal elasticity. So sometimes people will say it just isn't comfortable, but oftentimes I find that if they increase the duration of their foreplay, that piece is ease. It isn't, let me say it this way, that a lot of people don't take enough time for the female arousal phase. Men, it typically takes maybe 5 to 7 minutes for full arousal to be achieved, where the female body takes 18 to 25 minutes for full physiological arousal. You might be rearing to go and ready to dive into action, but it takes your body and the structures and the blood flow that much longer to really get to heightened state in order to get to full comfortable arousal, which can make for a more comfortable penetration in the hand. Then we have plateau phase, which I'm sure we've all been there at some point or another, but this is when you're like right on the edge and it just seems to be pausing and you're like, come on, we're right there. The clitoris will actually kind of retract a little bit and take a little bit of a per se rest, right? And the other muscles in the body will start to kind of tense, but it does have an increase in more blood flow. And like I said, you're right on the edge. It'll just kind of be a sometimes brief, sometimes long, flat line, if you will. Then we have the orgasm, the phase. This is the phase of climax, right? It's the shortest phases, generally lasts only a few seconds, but can last a little bit longer than that. This is where the muscles will involuntarily contract. Blood pressure, heart rate, and breathing are at the highest rates during this portion of the sexual cycle. I find it interesting that the muscles in the feet will spasm, but it's because the nerve roots that are connected to the pelvic floor are the same nerve roots that are connected in the feet. So there's a really strong connection of your feet and the pelvic floor. There's oftentimes a sudden release of sexual tension. The muscles in the vagina of the pelvic floor will contract, like I said, but you can also have a uterine contraction. Then you might have this little sex flush, per se, appear after and experiencing orgasm. And then you have the resolution phase, and this is where the body starts to begin to slowly return to its normal level of function, and swollen erectile tissue will start to come back to their previous size, and usually kind of a euphoric state. I like this picture just because it can show how variable it can be from individual to individual. For the female, you can see that some women might have multiple orgasms fairly easily. Some might have a big rise in excitement and then a little bit of plateau. They have orgasm and then a very quick resolution. Versus others may have this kind of steady plateau, but not really ever achieving orgasm. And then they kind of fade into resolution. And then men, again, it's just a lot quicker, a lot more simple, oftentimes for them to achieve orgasm, and they'll jump up into that state and then quickly come back onto the resolution phase. So where to start? I often tell people who are struggling with having, per se, a good sex life, or they want to improve their sex life, is to go back to the basics and start with cuddling, connecting at like the very basic levels that you used to when you were dating, whether that be kissing, massaging, things like that. Sometimes couples have been together for so long that they forget to that they used to enjoy that sort of, right? So we're going to start with the erogenous zones, like I mentioned earlier. A lot of these, like I said, may be familiar to you, but there were some on here that are less familiar. So take some time, make some notes, and just explore what some of these areas are. I will say these are going to be your most common areas of erogenous zones, but that doesn't mean that you have other, per se, hidden areas. So this is where it's important to really take time and explore your own body, or have your partner explore your body too, and find what turns you on. Find those buttons that can be pushed that can help stimulate and trigger at more arousal, right? It's going to vary from person to person. You have the G spot that we talked about previously, and the clitoris, of course, the mons pubis, or the pubic bone itself. Sometimes that's exciting for some people. The perineum, that area behind the scrotum and between the vagina and the anus itself. The foreskin of a uncircumcised penis, the scrotum and testicles themselves, or like I mentioned, the prostate. The scalp, the hands, fingertips, the feet, behind the knee. Explore is the ultimate the ultimate way to explain this, is you just have to explore your body. But I also think toys can be underutilized as well. So there are a wide array of vibrators. These are clitoral stimulators, and then a vibrating ring for a penis too. There are so many options out there. You can scroll for days trying to find various types of vibrators. And if you're just starting out, you're a little nervous, I would start with something basic, maybe just like this very simple bullet vibrator shown here too. You can have a direct clitoris stimulator here that has a little bit more air pulse waves. This is just a basic clitoral vibrator with different speeds and patterns, but they get so much more complex than this. I just pulled some of the basic ones. And then a vibrating ring for a man can help bring blood flow to the area and help maintain erection sometimes too, if they're struggling to maintain erection. And then sometimes people just get in a, per se, funk, and they get stuck in a rhythm of just doing the same old thing. And so sometimes it can be helpful to get a card game where it provides you with some ideas of different ways to connect, whether it be, new positions, or it be games, or anything like that. Incorporating food or oils or whatever into the foreplay side of it can really be helpful in experiencing something new. I'm going to go back to this for a second. I think the other big piece of this is communicating, right? Like, I think that's the other big C outside of like coming and having an orgasm. The biggest thing is to be able to communicate. You really need to be able to explain to your partner what feels good, what doesn't feel good, and how to optimize what that experience is for both of you. So common problems that that we often see in the clinic can really vary, but I find a lot of times that there is this, per se, crisis of desire. Good sex versus bad sex. Good sex adds 20% to relationship, which is great, but bad sex drains it 50%. So if someone is, per se, having bad sex and they're just not having that pleasure, then they really need to, not need to, but it's advantageous to really work on trying to improve that and communicating with their partner what parts are not working for them, what needs to be changed, working with a certified sex therapist to help guide them through some of those challenges, or if it's uncomfortable, working with a pelvic floor therapist. A lot of times the sexual problems and distress, it shows that the most common issue is the lack of desire in the United States, or low arousal, which can then also perpetuate and lead into orgasm dysfunction. And there's this, I think, misconception in society that everybody should be having this like thriving sex drive, but it's really not that way. There is a wide range of desire and drive for sex, right? Like your libido can just be variable depending on hormones, how much sleep you're getting, if you have kids, how much stress you're under. So understanding what your drive is and what your partner's drive is, I think allows for, again, clear communication so that you guys can be able to connect more effectively, but also not have frustration when someone isn't meeting you where you're at, if you have a lower drive or a higher drive in your partner, right? So understanding and communicating clearly with your partner again. I do find it really interesting that there is this pleasure gap in couples though too. 57% of women said that they orgasm most or every time that they have sex with their partner, while 95% said their partner orgasms most or every time. How interesting is that? And this is, I will just have this caveat of this is more in a heterosexual partnership that this statistic is talking about. But it's just interesting how significant that pleasure gap is. And most men can achieve that orgasm the same way every time. And it's not that complex, like I said. While women need to orgasm, that can really vary drastically from woman to woman and even throughout their cycle. When there's these challenges, it can have conflicted feelings about sex, having greater focus on pleasing their partner over themselves. They might be self-conscious of their body, or again, poor communication. All of that contributes to that pleasure gap. Pain with intercourse. This is something that I am really passionate about, that intercourse should never be painful. It kind of breaks my heart every time I hear someone has been just grinning and bearing it and dealing with it for their life. I've had an individual who was 80 some years old and had just struggled with painful sex their entire life. And yeah, they were still sexually active, but not by any means in an enjoyable way, right? It should never be painful. So if you are experiencing pain, or you know someone who's experiencing pain with intercourse, please reach out to a pelvic floor therapist and their physician to try and start to get them on a healing journey. But that can be contributed by the lubrication, how much natural lubrication they have. If they need to use a different type of synthetic lubricant, it might be changing up the position, vaginismus, which we'll talk about, and again, scar tissue. There are so many types of lubricant out there. I can't even keep track. It's just as many vibrators as there are lubricants, right? I have heard a lot of different things as far as what people will use for lubricant. Please do not use Vaseline or baby oil or Crisco. Any of that can break down latex and also cause infections. There's even studies showing that your kind of standard KY jelly that you get at the farm or at the grocery store or whatever can cause burning in about 20% of women's tissue. So it's not necessarily the ideal. Really invest in a good quality lubricant. If you're doing any sort of anal sex, then there can be a cum lube or body butter, or boy butter rather, because they're a little bit more protective, a little bit thicker material of the cream. A lot of people do well with water-based lubricants. Pure and Yes are all great options. But sometimes people need a little bit more lubricant that lasts longer. And the same thing with coconut oil. Coconut oil is very common these days, but sometimes it doesn't last long enough for people. And so if someone's really struggling with dryness, I'll often steer them towards a silicone lubricant if they're not having success with other types of lubricants. Pink, their silicone lubricant or Uberlube are my two top recommends for silicone lubricants. It can really be a game changer. Some people are not keen on using lubricant because they feel like they should produce their own natural lubricant, or that it means that their partner isn't doing something right, or their partner feels like they should be able to get the woman to have that natural lubrication, right? But at the end of the day, if this is the simple solution in order to have more pleasurable sex, then by all means, like, lean into that. Speaking leaning into positioning, this can be a big game changer. As we age through our lifespan, positions can change. And I think a lot of people get hung up on what worked previously should work now, right? But that really changes as we start to experience some other orthopedic things, such as back pain, knee pain, hip pain. The images over here on the left show the flexion tolerance, so bending forward is going to be this top one here that's going to be more comfortable, if that's more comfortable if you're struggling with back pain, and forward bending is comfortable. For back pain where extension or going backwards is more comfortable, you might tolerate more missionary style. But I often think too that utilizing wedges or pillows, as this other side of the slide shows, that needs to be utilized as well. That can be really helpful for managing positions, depth of penetration, and various factors to make it a little bit more comfortable for penetration to be successfully achieved. For women who struggle with pain during penetration, I find that these two positions are oftentimes the best. So having your male partner, coming from behind can minimize how deep they can penetrate. And you can use a hand to kind of block their thigh, so maybe they don't come into the vagina quite as deep. Woman on top is oftentimes a good option because it really helps the woman have control in the pace, the depth, and everything. I will say, however, that missionary can be a great position too, especially if those pelvic floor muscles are tight, because the hip muscles can be a little bit more relaxed in missionary, especially if you take a couple pillows and kind of tuck them to the side, then it can just be a lot more comfortable. The muscles will be relaxed, and then you can use your hand to block at the thigh, or using a product like this O-Nut to help minimize the depth of penetration. This is just a silicone per se bumper that minimizes the depth of penetration of your partner or toy. It's a really great product. They also have vibrating options for this as well. Vaginismus is when the pelvic floor muscles are actually too and it's an involuntary contraction or tension within those muscles. Really have to work with a pelvic floor therapist to work on relaxing those muscles and learning how to connect with them properly to relax. Sometimes you might need to use some dilators to allow for comfortable stretch and progressive stretching of the pelvic floor muscles themselves. Penetration can be completely impossible with vaginismus, as it shows in that first picture here. But most of the time it's just like this one here, where it's just tight and painful because the muscles, again, are just overly tight. Scar tissue can really play into discomfort as well. Like I said, whether it be a vaginal delivery where you had an episiotomy or you tore at the perineum, or if you had a cesarean scar, that can create a line of tension within the uterus, and that connects into the vaginal vault, that kind of end of the vagina, which can oftentimes create pain and discomfort with deeper penetration. So if you've had a cesarean and are struggling with deep penetration or deep pain with penetration, then definitely connect with a therapist who is well trained in some scar tissue manipulation. Visceral manipulation is also extremely helpful and a game changer for these. So lean into pelvic floor therapy. It's such a passion of mine to help people who experience pain and try and optimize their experience through their sex life. And so really find a therapist who understands the pelvic floor, works internally with the pelvic floor, so that they can rule out any struggles like that. So quick summary of tips for better sex. Try and let go of the goal-oriented approach to intercourse, for say, focusing on orgasm itself, and try and redirect that focus more on pleasure being the, and also educate yourself and enhance the awareness of yourself and your partner of various erogenous zones, what your fantasies are, what feels good, what doesn't, where is that, and being able to communicate with your partner any likes or dislikes of that. Lubricants can be very key, as I mentioned. Oh wait, sorry guys. And also trying vibration to help increase the blood flow, provide that extra stimulation to the clitoris, because I don't think I said the statistic, but the latest research is showing that less than 10% of women achieve orgasm by penile penetration alone. So you need to have that. The vast majority of women need to have that assist in order to achieve orgasm. So being able to embrace that and be open to that can be really helpful. Addressing any physical discomforts, making sure there's no infections present or anything like that. Finding, again, a pelvic floor PT. Managing stressors in life. The exercise itself can really, has really been shown to improve an individual's sex life. Increases activity of the pelvic floor muscles and general strength of the pelvic floor muscles. Meditating and trying to calm that busy mind, like we talked about. Journaling through any stressors through life, but also if you're really challenged with the phase in life that you're working through, connect with a mental health professional, or even further working with a certified sex therapist, because remember, our brain is our largest sex organ. You can also try aromatherapy to get things started, because the nasal passages are that direct pathway into the limbic system and in our brain, and it really does control those emotional responses, which is why I have Melody joining us here to talk a little bit more about how to connect with those pieces too. Briefly, any questions about all of that? That was a lot, I know. Awesome. Well, I'm going to hand the time over to Melody, my dear friend Melody Watts, who is an aromatherapy expert and can really dive into how to utilize this for improving sexual response in the bedroom.
Awesome. Well, thank you so much, Chelsea. That was so amazing. I always learned so much in your classes. I'm like blown away. My sons walked in during the training. I was like, look, you guys, isn't it amazing? They were dying. They go, send us that presentation. So that was really awesome. I learned so much, and I'm really excited just about all the new information. So thank you. As a 44-year-old woman, I feel like I should have known some of that. So just to let you guys know, my background is essential oils and functional medicine, but this is one of my favorite topics. We do it every February. I feel like it's going to be a more prevalent topic as we go forward, as people are getting more comfortable talking about sexual health, because it is such a great bonding tool. And I think that it needs to just be such a healthy, great connection. So I love it. So this PowerPoint I actually got from my friend Ricky Evans, who actually wrote a book called Spice Up Your Love Life with Essential Oils. And a lot of the recipes in here I've used, and I think they're incredible. So I'm going to go through and just talk about different oils you can use, what the function of those oils is, how it interacts with your limbic system, how it interacts with your hormones, how they act as aphrodisiacs. So I'm really excited to jump in. So what are some health benefits of having sex? So less stress, better blood pressure, boosts immunity, burns calories, improves heart health, better self-esteem, deeper intimacy, can actually help pain. More ejaculations can make prostate cancer less likely. And then, oh, hold on, it's not letting me see there. Stronger pelvic floor muscles and also better sleep. So love that. Let's talk a little bit about some aphrodisiacs and why that can be really beneficial. So different smells can really arouse the senses. They improve libido. They can lower sexual inhibition. So just relaxing the central nervous system creates an environment for increased sexual pleasure as well. I've experienced this personally many times. We always use our essential oils, and it always is relaxing. And I'll tell you a few stories as we go into what recipes we have. So here's a few oils that can help boost intimacy. They're very warming, so they're going to help increase circulation. Black pepper, mixed with sweeter tones, actually is just incredible for warming, strengthening, and it can help renew the flames of passion. Cinnamon is regularly used to relight fires, boost sexual desire. It's also warming. It's very seductive. On an emotional level, it's a sexual healer, so it can help when there's been sexual trauma. Sandalwood is also a very erotic aroma, and it can promote emotional openness and increase physical sensuality as well. And it can help lovers get out of a sexual slump on an emotional level. So the other one is ylang ylang, sorry. And it's actually a really powerful aphrodisiac. Sometimes we refer to it as yabang yabang. So it's a kind of a funny little thing there, but because it's so helpful at just increasing the sexual desire, right? And I know for a lot of women, it said, on what Chelsea showed, 38% of women or of people just say they have lower desire. So ylang ylang can really help with that. Some people prefer the smell on its own, and some people prefer it just as in a blend. So I'll show you some different ways you can do that and what blends that is in. So here's an example of a really great sexual desire boost blend: black pepper, ginger, and sandalwood. This is going to be more of a masculine blend. So this is great for men. One of the cool things about ginger too is you can take it internally. It's really good for helping keep an erection. So quick story about this: there's a blend we have called MetaPower, and it has ginger in it. And I do not recommend this, but there was a group of guys, and they had kind of this bet going, and they took more of these MetaPower drops than they probably should have, and they had like an erection the whole day, and they were like, what is in this MetaPower oil, and it's the ginger. And so it's really good for just helping that, if that's a problem with people, it can help with erections. So this also blend on the right, the cinnamon, ylang ylang, and ginger, is a little sweeter, and this is really great too. You can put it on your wrists, pulse points. You can put it on your ankles. You can put it over your ovaries. There's a lot of different places you can use this. The seduction blend, the wild orange is going to put some sweet citrusy tones in there. And then anytime you bring in the floral smells like rose or geranium, those are really, really good for increasing connection and helping walls come down and enhancing trust. It's really great. Rose and geranium is really great over the heart. And it's also good just over the abdomen, because rose and geranium also have some really good cleansing properties. So it's good for helping things like bladder threats and things like that, and bacteria, and even like some of the, it can help with aroma and just overall smell of the vagina. It's really sweet, and it helps clear out different kind of maybe threats without disrupting any kind of flora, which is really great. So you can add it to your lubricant or whatever you want to do, and it's really great for that as well. Increases blood flow, especially the geranium. Geranium also is really good for progesterone. So I actually will use the geranium over my adrenals sometimes, or I'll use a blend with geranium in it, and it's really good for just when progesterone has kind of been depleted due to stress. So geranium is really great for that. It's also, geranium is actually really good for menstrual cramps as well. So overall, geranium is just wonderful for the female organs, hormones, blood flow, and just health. Okay, so Venus blend, ylang ylang, rose or geranium, lavender, and sandalwood. This is kind of bring in some of those earthy tones. The sandalwood, again, is going to have more rich tones to it, which just really levels out that ylang ylang and some of the floral scents. Okay, you can wear that as a perfume. Oils for him, he can also use wild orange and rose. I sometimes like to add a citrus to it, and one of my favorite actually oils to add to this libido blend for men is actually patchouli. Patchouli over the heart are mixed with this blend, and doTERRA's patchouli is very sweet with some mint undertones. It doesn't smell like the average patchouli. So most people that don't like patchouli, they smell doTERRAs and they're like, oh, that smells totally different from what I'm used to smelling. And it's very clean and fresh. But what patchouli does is it helps connect the mind and heart when there's been a disconnect or a trauma. So it can help just make people more present. You know, when she talks about the orgasm beginning in the mind, something about patchouli is really good at just connecting you to yourself so that you can be more present in the sexual experience. Ylang ylang and sandalwood. So we're seeing just different blends and different ways you can do it, but you're always going to have some of those common threads, the ylang ylang, the sandalwood, things like that. And then here's some good ones. If you wanted to start, remember she talked about the nerve endings being at the bottom of the feet. Sometimes just a good foot rub with essential oils can warm up the oven a little bit, right? Especially with females. So this is a great way to apply the oils as well, to just get connection going and physical touch going that can help with just overall connection and increasing libido. Okay. Also, you can do some fun massage blends as well. Sensual massage is a great way to start out with a little bit of foreplay and connection. There's that patchouli I was looking for. This is just a very fresh and earthy citrusy blend over here on the left. And bergamot is the oil of self-assurance. So it can help you feel more confident in the bedroom as well. So that's a great little blend there. And then the spicy one with ylang ylang and black pepper is a really great one. This blend is sizzling and it warms your skin and lights a fire. So you can massage this on the feet, on the legs. We love doing like inner thigh massages, back of the legs, front of the thighs, belly massage, chest massage, things like that can just be a great precursor to intimacy. This is a great nutrient complex, and surprisingly, deficiencies in people is at an all-time high. They say there's research that shows about 95% of Americans are deficient in one or more nutrients. So one of the reasons why I really love this combo is how well they formulated it for daily use. So it's micro doses of your common vitamins and minerals, antioxidants, and essential fatty acids. And I have seen this change people's fertility. I've seen it change their mood. One thing I love about the way that they formulated the vitamin mineral complex is they formulated it with food, fermented food. So it's very bioavailable. It's one of the best rounded supplements that I've seen out there. So I love this for overall stress as well. We see a lot of people taking B vitamins for stress, but they're taking synthetic forms or ones that aren't bioavailable that can irritate the bladder. So one thing I absolutely love about this is it's all food-based and non-synthetic forms of vitamin B. And so you're just getting a higher quality, more absorbable, and you're not getting like this mega dose. You're getting a dose that can be sustainable and can help with just metabolism and overall mood. When we are stressed, our body utilizes more vitamin B and magnesium. And so being able to just supplement with this and microdosing, especially if we don't have a really high quality, sometimes when we're stressed, we don't eat the best. And so being able to supplement with something can be really, really great. Okay, so the Mito 2 Max is actually something that I supplement with every day. And the reason why this is a great herb to bring into libido is for a few different ingredients that I think are really helpful. Ashwagandha is an adaptogenic root, and it's really good for the stress response. So it helps lower cortisol and stress in the body. So like Chelsea talked about, when people get stressed, their sex drives can kind of go down. And so this is a great way to just relax the body. It also has cordyceps in it, which are mushrooms that help with just overall energy and stamina. And then the other thing that I really love about this is the mitochondria supporting cofactors. So you have things like L-carnitine and CoQ10 and green tea and things that are just natural sources of energy. And for me, this is a really big one because I have a tendency, or I had a tendency in my life, to be always on the go in fight or flight due to some childhood trauma. And when I started taking this, it really helped me get my energy back and helped me become more aware of things that dysregulate my nervous system. So I really love this particular supplement. Okay, so I'm going to share with you guys a really amazing kit that in blends that we actually put together for you that contain all those oils that we talked about. But first, if you guys want to scan that, you can right there. And I'm going to pull up this link actually so that you guys can see this amazing aromatherapy kit that Chelsea has put together for you. So let me just pull this up. It's just wants to give me a hard time. Hold on. We'll get it. Okay. So I'm going to go through all the different oils in this kit and why we really recommend them. Some of them we didn't talk about, but I'm going to talk to you about what makes them so unique and so powerful. So the first one is Neroli Touch. And we have found this one to be one of the best oils for the stress cortisol response and also just overall intimacy and connection. So we actually use this one right over the adrenals. It has an amazing floral smell to it. It also is something that they use in Egypt on their wedding days. It's a beautiful neroli flower. And it's also something that the prostitutes in Egypt use to attract the men. So you got the best of both worlds. They use it on the wedding day and it like represents purity. And then you have it also in the red light district, right? Because I don't know, it represents intimacy and connection. So I thought that was kind of a cute story about the neroli oil that we get from Egypt. It's just a very beautiful smelling oil. It's highly anti-inflammatory. Sometimes we even use it over the thyroid and just different organs, adrenals and things like that to help with metabolism, inflammation. But on an emotional level, the smell is so intoxicating. Then of course we have our ylang ylang in there, which is a beautiful floral aroma. Passion. This passion touch can be used right on the clitoris because it's diluted in coconut oil. So that is something that is really great. It has things like cinnamon in it and jasmine. Both are big time aphrodisiacs. And then we also put the 5 ml passion there. So if you want to diffuse it, you can. One time I had a bottle of grapefruit and I had put passion in it. I don't even know why, but I thought I was diffusing grapefruit and I put the grapefruit in my diffuser. I started up. My husband was already asleep. And I turned it on and he woke up ready. He was like ready to go. That the smell just was totally intoxicating to him. And so it was kind of a really funny thing that it woke him right up out of his sleep. And he was excited to connect with me. Whisper Touch. So the Whisper blend has all the oils we just talked about, the bergamot, the cinnamon, the sandalwood, the ylang ylang, the patchouli. This is the ultimate libido blend. It's an incredibly intoxicating perfume. It also has vanilla absolute in it, which is, again, a big time libido aphrodisiac. When people smell the vanilla, because most vanilla is synthetic, I actually get headaches from like the vanilla candles and lotions that people wear. This is so intoxicating. When you smell it, it goes right to this olfactory system and immediately relaxes the brain. It's also been studied to show the aroma of vanilla is good for testosterone in men and women. So there's some really great research on that. So I love this blend. It is my all-time favorite blend for aphrodisiac. And then the cinnamon bark is going to be incredible for metabolism and just overall libido. I love to put this in like a hot tea or just sip on it in my water. It's very, very sweet and again, very warming. This month you do get free digestin. If you order in the month of February with this particular kit, you get digestin and digestin soft gels, which is really great because it helps soothe the digestive system. It has ginger in it, peppermint, fennel, some of the really great things in it that can help soothe the digestive system, which is also really good for libido. I will say one more thing. If you guys wanted to add something or take away from this cart, you can, but there is something called a beautiful body spray. And I highly recommend adding the beautiful body spray to your order. If you want to take something off, you can. Maybe you trade it out for the passion or whatever. But let me tell you about this beautiful body spray. It is an incredible lubricant. When she was talking about lubricants, I was like, oh, we have to add the beautiful body spray. But the smell of this they call it a captivating blend. So wearing perfume can be really disruptive to your hormones This is incredibly hydrating, and it also just has this aroma in it. It has osmanthus flower in it, which is just this captivating aroma. It's a flower, and it's a little similar to neroli, but it also has bergamot in it and other oils in it that just are so intoxicating when you put it on. So it's really great for a pre-done body massage or lubricant. My husband absolutely is obsessed with this blend when I put it on. And I just love having a non-toxic aroma. I'll mix this with my Whisper blend, and it's just incredibly intoxicating. That's all I'll say. And it affects the brain and the limbic system right through the olfactory system. So it'll go through, and the minute you smell that real aroma, not a synthetic perfume, it goes in and starts working with the limbic system in a direct pathway to the your brain chemistry. So it's going to go in there and it's going to help with dopamine and serotonin, which totally enhances all the senses when it comes to the sexual experience. So that's all I have. So hopefully that was really enjoyable for you guys. I'll go back to the code if you guys want to grab that or snag that code. There it is.
Awesome. Thank you so much. There's so much information to learn about that and like how you can incorporate it and all the great things. So yeah, if you guys have any specific questions on oil usage or anything, feel free to reach out. I'll try and answer your questions, but Melody is my resident expert that can definitely fill you in on all of that as well. Awesome. Melody, if you don't mind, stop sharing your screen, and then I'm going to shift over to Dr. Cami. Yeah, and Melody dropped that link in the chat there too. So Dr. Cami Hurst is a certified sex therapist here in the Valley. And she is the president of the Idaho Sexual Health Professionals that I'm a board member of. Such a great resource. And I asked her to join us today to talk a little bit about maybe some of the things that she often sees in her practice and how she can help couples improve their sexual experience, but also navigating things through a lifespan and like how our sexual experience evolves over life. So Cami, did you want to share your screen? Do you have it there? You should be co-host and good to go.
Let
Awesome.
me give it a
I'm going to
whirl.
hand it over.
Yep. All right, so we are going to share my screen. So give me just 1 second. Let me get it to where I want it. All right, and this allows me to share and see the profile, but it doesn't allow me to see the chat. Oh, yes, I can. So I would kind of love to see the live stage of the participants. So maybe in the chat, let me know so I can spend time that's appropriate to our audience. And I'll do what I can to adjust. I'm actually not seeing the chat. Oh, there we go. All right. Thanks, Chelsea. Yep, that helps me. So yes, who am I? My name's Cami Hurst. I'm here in the Valley. I have a private practice. I'm a licensed mental health therapist. I have my master's degree in marriage and family therapy. I have my PhD in clinical sexology, and I'm an ASECT certified sex therapist. I love to educate and play and advocate with Chelsea. So I'm really, I'm honored she'd asked me to be a part of her practice. It shows a lot of trust, and I appreciate her professional trust. And I'm also a host of a podcast. It's been going maybe 3 years called Sex Therapy 101. So if you've got additional questions, I've probably done a podcast on it. You can go and search through topics if I don't answer the questions you were hoping to get answered here today. So when you're looking for a sexual health professional to help you with your concerns, you're really looking for someone who has specific training in this list of areas. Sexual dysfunction in the areas that Chelsea already outlined: desire, which is different than arousal, which is different than orgasm, which is different than pain. These all have different components and also different interventions, and aversion, trauma, education, identity, orientation, compulsion, pharmacology, kink. That's who you're looking for. If you're saying, hey, I need a professional who can help me in the sexual arena. And I point that out because we have an assumption about providers in our life, right? So why aren't counselors and MFTs qualified to address sexual issues? Some of them are. If you look in their bios, see if they've got training in that list that I just gave you on the previous slide. The reality of the matter is that licensed counselors are only required to take a basic undergraduate course in human sexuality. And that course doesn't address any of the dysfunctions that I listed in the previous slide. Okay, what about marriage and family therapists? Okay, marriage and family therapists, they're required to take one master's level sexual health, and it's usually human sexuality. It doesn't address dysfunction or treatment of dysfunction. It goes over a lot of what Chelsea gave to us today, which is fantastic, and we need to know that. But they're not all counselors and not all marriage and family therapists have any training in sexual concerns. That's important for you to know. It's also important to know that the research is showing us that if you have a sexual problem that persists for longer than 6 months and doesn't resolve on its own, it probably won't resolve without specialized sexual health professionals like a pelvic floor physical therapist, like maybe some looking at some hormone issues and working with a sex therapist, okay? Why isn't your OBGYN and your urologist qualified? Well, they are qualified to do a lot of things, but most are only required in their medical schools to have a 2 to 5 hour seminar on, which is just someone talking at them, on treating sexual dysfunction. So they, unless they've done extensive education after they've gotten their medical license, may not know how to treat your sexual concerns. And those are usually the people we go to. And, you know, so it's good to know specifically who you're looking for. There are really 4 areas that impact our sexual health. There's the biophysical, so that's what's happening with my actual body. Are there hormonal issues happening? Are we receiving adequate stimulation? Like, there are biological factors to our sexual functioning. There are also sociocultural factors about our sexual health functioning. That's the attitudes from our family of origin, our community norms, our religious theology about sex. Psychological things can also impact our sexual health. If we have some past trauma, if we have some repression, if we have depression or anxiety or guilt or shame, those are psychological issues that can impact our sexual functioning. And then relational issues can also affect our sexual functioning. How much affection there is outside of sex. What's the current climate of the relationship? What's your sexual history in your relationships? What's the season of your life? Those all impact how we experience sexuality. And so, you know, I like to address with my clients first that sexuality is a part of our wholeness. It's just as valid as the intellectual part of ourself, the spiritual, social, emotional part of ourself. When we are most happy, when we experience the most mental health benefits, it's when those factors are all balanced and aligned. But a lot of people walk into my office just skewed, right? Maybe like this is an example of me. I tend to lean into the intellectual too much. I'm a nerd. I love to learn. I love to read. I have to work to balance that with feeling, balance that with all these other aspects of myself. For a lot of people, they'll come in without any sexual piece of the pie here on this pie chart. Maybe they didn't know it was valid. Maybe it was really villainized in their upbringing, lots of reasons. So that's kind of the overall goal when you work with a sex therapist. And a sex therapist is specifically trained to know the biological, sociological, psychological, and relational interventions that can help with your sexual health. So I think most of our audience here is female today. And I believed that's who I was preparing this for. And so, you know, if we run through common female sexual difficulties, it's most women will experience some kind of sexual difficulty across their lifespan, whether it's inhibited desire, inhibited arousal, absence of or difficulty with orgasm, sexual pain, which would be vaginismus or vulvodynia or vaginitis or lichen sclerosis. A sexual pain presentation is extensive and separate. We can maybe do that sometime. And even some aversion. And so, are we going to slide here? Yeah. So let's define sexual health, because we want to be sharing words with the same definition as I continue here. So I operate from the model of sexual health that was given to us by the World Health Organization after they did a large study and indicated that, hey, if these 6 principles are present, the world at large would have no sexual difficulty or sexual harm or sexual trauma. These are the basic principles that I'm teaching my clients, working to instill within their relationship and giving them a model of how to teach sexual health to their children also. First principle, consent. Sexual health requires that sex be consensual. This is the most universal principle. It means voluntary cooperation. It does not mean I was talked into it. That's verbal coercion. Okay. So it's communicating permission to reach sexual satisfaction. It's saying, I want this experience. I want it to impact me. I want you to be the one who experiences it with me. And I'm enthusiastic about, hopefully, what will transpire between us. Second is non-exploitation. This means that there's a balance of power between the individuals. The most common exploitation that I see in my office is if there's been some type of betrayal with an affair. The exploitation part is maintaining power to keep a secret. Another form of exploitation is using your power position to get sex, of, hey, I'm the breadwinner, you owe this to me, or you promised we would have sex, and I'm going to now expect that. So non-exploitation means that we are working to balance the power in the relationship, that what both of us want matters. Protection from STIs and unwanted pregnancy. Most of our sexual education in the West, this was all it was. It was just, how do we prevent a pregnancy and how do we prevent a sexually transmitted infection? This is a really important part of sexual health, but it's 1/6 of the education that we need in our communities to prevent trauma and difficulty. Honesty, meaning we both agree what this means. A one-night stand isn't in and of itself unhealthy if both people understand this is not a commitment to a relationship. We both are honest about what this experience means to us. A chronic lack of honesty often leads to non-consensual or exploitative behaviors. Shared values. I care a lot less about what the value is with the couples and the individuals I work with, and care more about the ability of that couple to come to a consensus of shared values, really, really clear agreements about their relationship structure with high integrity to keeping those agreements. Very often we fall into relationships and assume that we both have the same values when often we may not, especially as we evolve. We will be different people in our 40s than we were in our 20s. Things will matter in different levels. And mutual pleasure, that the primary motivation, whether it's alone or together, is to receive pleasure through sexual experience. And what brings us pleasure often changes from our preteen to late life. And we can experience a lot of sexual difficulty if we think that what worked for us when we were 16 will work for us when we are 60, that rigid hold to wanting things to be how they were when we were in our prime. Having a sense of flexibility and exploring pleasure across the lifespan is something I do a lot with my older couples. All right, so I just wanted to have a common foundation. That's what I'm talking about when I say sexual health. We're holding to those principles individually and as a couple. The most common blind spots that I'm working with is people who define sex as a penis in a vagina. PIV, penetrative sex. That's a problem. You know, I love that hearing from the aromatherapist about different scents and how they work with our memory and our arousal. What I wanted to do is say, okay, we just listed all these benefits of sex, but that's not the benefits of intercourse. That's the benefits of having a mutually enjoyable sexual experience. So I'll see couples come in and say, I'm having sex, which what they mean is that we're having penetrative intercourse, but they're not having mutual pleasure. So they're not getting the benefits listed. That's what most of us received. What we needed instead was consent to education. What most of us received was fear and shame around an unplanned pregnancy, but what most of my couples need actually is education on mutual pleasure, ownership, discovery, communication skills. What most of us received was a fear of STIs. What we need actually is education about those STIs, how to treat them, how to prevent them, rather than just the fear of their existence. Many in our community and those that I work with receive the message that once you're married, it's going to be good, it'll work out, just keep trying. When what we needed was actual education about sexual skills, sexual functioning, and uncoupling this idea that if I love someone, the sex will be good. Most of my couples, we are not questioning the love in the relationship, but we are addressing major sexual concerns and issues that are hurting both people. And depending on the school district you grew up in, mine was an abstinence only education, and it presented that as the only sexual value out there rather than the 6 we just explored, that consent is a sexual value, honesty is a sexual value, non-exploitation is a sexual value, and pleasure is a sexual value, that you can have very strong sexual values other than abstinence, which is what most of us were presented with. And I hope you had a different experience. I'd love it if you had a different experience than I did. I grew up here in Idaho. So, you know, Chelsea said, let's look at some items of keeping a relationship healthy in the postpartum. I'm seeing many people in the chat might be past some of this, but it will be interesting, I hope, to all of us. You know, the top relationship issues for the partner of the person who just had a baby, their issues are, you know, feeling stress for providing financially in that interim, if there's a loss of income, and there are added costs. Both are often tired and fatigued, increased chores, increased work when there's a new child. We'll be dealing with our in-laws more. There's definitely a loss of free time. There's a decline in the spouse's sexual interest, almost always. And, you know, couples now are going to be re-exploring their roles. Come on, slide. Top issues for the mother or the individual who delivered the baby. Lack of sleeplessness is the top. Personal doubts about their skills. Unpredictable shifts in mood and anxiety, both from hormonal shifts and the fatigue. Feeling some dissatisfaction with their personal appearance. Increased labor, individual stresses, and a change often in their work situation, which can create an identity crisis. Common relational issues, things that they share. They're adjusting to a new member into the system. That will always disrupt a relationship, making room for a third or a fourth or a fifth. The couple will have to re-alter their relationship as a couple to make room for the new child, how that impacts their routines. And the couples move up a generation by becoming parents, right? So there's this circle of life and hierarchy that is happening, which brings on new roles and responsibilities. So as much as we love babies, it is the most traumatic time for a relationship. The research is showing us, the Gottman, that introduction of the first baby is traumatic for the couple often. That year following the baby's arrival is filled with joy, but also a lot of transition and difficulty. Mom's sexual desire tends to drop considerably. Mom gets very involved with the baby. Moms and dads both undergo enormous changes. And, as soon as the baby's born, there's often a large influx of support for the mom from her friends, her family, and it can often be very, very lonely for the partner, actually. High reports of feeling unsupported for the partner in that time. So, there's a lot of encouragement to now practice healthy conflict management, maybe for the first time throughout all this transition. Most professionals encourage creating new roles, verbally, new rituals, new traditions, preserving the adult relationship, figuring out intentional ways to be a family, and then intentional ways to be a couple, and then intentional ways to still be an individual. So let's talk about postpartum sexual health. What's happening in the relationship will impact this. What's happening in the body will impact this. What's happening in the psychology of the woman is happening this. It's the bio, psycho, social relationship model. They all, during this time of postpartum, become almost like a superstorm. And so they're all contributors here at this phase of life. There are significant reproductive changes. There's healing that's happening. There's discharge, continual leftover. Our bodies are so fantastic, but they don't heal the day the baby comes out. There's a 6 week, and after, if there's a cesarean section, of intensive healing happening. There's a shift to redefine sex. If sex before was really dependent on intercourse, the challenge is to shift to outer course. How do we find pleasure and connection when nothing can enter the vaginal canal? And that can be extremely demanding for couples who've never explored how to have sexual pleasure without something in the vaginal canal. Funny story, I have a friend who was very low desire. Their definition of sex was intercourse. And so when the OB said nothing goes in the vaginal canal for 6 weeks, they didn't touch for 6 weeks. The funny thing was, he heard 6 months and she did not correct him. So there was now no touching, no caressing, no connection, no affection for 6 months because they said no sex, because he thought sex was a penis and a vagina. And so postpartum, even postmenopausal, if there's our tissues, estrogen drops and our tissues become very fragile, like tissue paper, lichen sclerosis and micro tears are fairly common. And so this shift, if our definition is strictly on intercourse, and there are some changes biologically happening in the vaginal canal, we can set ourselves up for a lot of distress. But shifting our definition and shifting our skills to work around a fragile vaginal environment is really key to surviving these physical transitions as a couple. There's going to be the development of possible some scar tissue that we're going to need to work with a pelvic floor physical therapist, with instruction of how to soften any scar tissue that's developed. And I have 4 children. So my scar tissue has become considerable as I've torn continually with an episiotomy right in the same spot, or maybe a little bit. It's significant. It's needed care. And I've needed sexual health professionals to help me while that tissue heals. Your experience with lubrication and functioning is going to change during this time, and your perimenopausal time, and your menopausal time, and your postmenopausal time. And it's really important that you don't listen to any old wives' tales or myths about playing through the pain, or that it will get better. Like was mentioned before, we don't need this to be painful. In fact, the more you pair sex with pain, the more difficult the psychological blocks are for me to work with as a sex therapist. You're going to need care for pelvic floor care. We're the only country, like Chelsea said, that doesn't do this. We receive more physical therapy for like a sprained ankle than we do for after we've carried a child independent of the delivery mode it's needed. We're the only country that doesn't pay for that in our insurance as normal healthcare. We're the only country where you'll ask dozens of women and they aren't sure what pelvic floor physical therapy means, but it can help prevent pain. It can help prevent any kind of prolapse or repair any kind of prolapse, whether it's a rectocele or anyway, that's all Chelsea's bread and butter. But do not play through any pain, okay? We usually take a team approach as a sex therapist. I don't have a license to touch and look. Chelsea has a license to look and touch. Sex therapy is like talk therapy with someone who knows a lot about the biological, psychological, sociological, and relational effects on sex therapy. So a team approach with a sex therapist and a pelvic floor physical therapist is really our preferred way to work because we each have different limitations and we each have different skills. And I want to normalize that this is why your OB might not be really helpful after the birth is the lack of training. Hopefully a fantastic OB will be giving you fantastic referrals to pelvic floor physical therapy and to sex therapists. So, there's a lot of common concerns about resuming intercourse, some pain. It can be scary. We can have a new relationship with our genitals because now it's about delivering a baby, maybe not associated with pleasure. You might have a new relationship with your breasts. Your partner might have a difficult time eroticizing you after a delivery and breastfeeding. And so cognitively, we might have to work through what was sexy, what things mean when there's this massive change. There's these expanding roles, which can work for or against our sex drive. Often when we see our partner in a new role and we see them doing well, that increases our desire. When we see them in a new role and we don't think they're doing a great job, it can work against our desire. So seeing each other in this new light will impact your connection. It will be a transition. If I had enough time, this would be a whole presentation about the desire basics, about styles, that difficulty is normal, that it's common for couples to go through shifting desires in their lifespan, that loving someone and wanting them erotically are two totally different experiences. We can love someone and not want to have sex with someone. We can want to have sex with someone and not love them. And we work to have both, usually in our primary relationship. There are some common desire diminishers, and we're going to talk about those next. Desire has a ton to do with context. We all have sexual breaks and sexual accelerators. And a major adult life development is becoming the expert of your own sexual breaks and accelerators, and then having the skills and security to share those with your partner. It's probably 90% of my job right there. It's helping people become the experts of their sexuality and then helping them develop the security and the skills to share that with their partner and to receive those from their partner. So common desire diminishers here that happen when children enter a relationship. Often we have too much familiarity with our partner. They're no longer mysterious. We see them naked, and so it doesn't get us going anymore. There's too much comfort. There's boredom, emotional discomfort. There's a lack of novelty, variation. The transition to motherhood is often the lowest a woman's desire gets in her life. The transition into motherhood and that phase of nurturing children. It's a busy, stressful life. We often de-eroticize our partner. There's a contrived illusion of safety in this stage. And so a lot of people put their relationship on the back burner because of this stress, which just means we have more work to do down the road. And the over-domestication diminishes desire. And we have research that shows it doesn't matter the gender of whoever is doing the most domestic labor. So in same-sex relationships, whoever is doing the most domestic labor experiences an extreme desire plummet. So that's good to know. It's not, hey, women, when they have babies, it's, hey, whoever is doing most of the domestic labor experiences a lack of sexual desire. Let's go backward. But what maintains desire? Okay, that's what we're all looking for. That's why we're here today with Chelsea. When we have communication, when we have intimacy, and when we have enough emotional distance that our partner we want them, instead of we have them, it's this idea of enough distance that there's still some mystery. So that's why it's so important to maintain your own personal friendships, your own personal talents, your own personal passion projects. That will lead to more desire between a couple because they continually see each other growing. They see each other trying new things and succeeding. They see them in a different light. That will maintain desire in a long-term relationship. Feeling seen, needing enough space that you are reminded that you are a woman, or you are a man, or you are a sexy individual. And we often need space to be reminded of our individuality. Sexual desire doesn't come from motherhood, or I'm a wife, or I'm a partner, or I'm a caretaker. It comes from I'm an individual worth wanting. And we need enough space and time in our relationship to explore that. Playfulness, fantasy and imagination. Couples who are having great sex in their 70s and 80s have developed their imagination together. Staying out of the bed, which I think that is referring to just keeping it novel, especially if a lot of childcare is happening in the bed. If there's co-sleeping, if there's a lot of feeding and diapering, let's go somewhere that doesn't remind us of this domestication. So when you are looking for sexual health providers, I just kind of told you at the beginning of this presentation, it's hard. You're not going to find them where you maybe thought you would find them. You're going to be looking for AASECT trained professionals as far as therapists. Sex therapists. This means that they have a 3 to 4 year education specifically on sexual health. You can go to the AASECT website to find them, but that is where, when you're looking through the Psychology Today profile for a good therapist, to look at their training and don't assume that there was sexual health education. There wasn't, and so it will be listed in addition to. So that's what you're looking for. Oh, and also individuals who are sex addiction treatment providers, or who label themselves that way, that's not the same as a sexual health therapist. They just have a training in a really narrow area of sexual compulsion. They don't have training in pleasure management and relationship skills. They don't have education on the anatomy and pain or anything like that. And so you're wanting to know what those terms mean as you're looking to work with somebody. If I were to give my top recommendations for at-home sex therapy, things you're working with, things most couples work through if they have a long-term relationship, my non-gender specific recommendations, to get out of a non-performative mindset and into a pleasure mindset, I recommend Sexual Intelligence by Marty Klein. If you're working through some maybe purity culture that you picked up in your background that seems unhelpful, my favorite recommendation for that, the book is called Sex, God, and the Conservative Church by Tina Sellers, and it is faith positive if that's still part of your worldview. If you're working through infidelity, my favorite recommendation is The New Monogamy by Tammy Nelson. It's written to help couples through the phases. If you have some sexual trauma in your past that seems to be the issue for you, the gold star for that is the book, The Sexual Healing Journey Why that's one of my favorites is in the end, it has exercises for relearning touch as a couple. So it addresses the couple, not just the individual, which we can't ignore the impact on the relationship. If you're wanting recommendations on how to raise kids differently, how to raise them with a sexual health mindset, free from sexual shame, but also with sexual values like consent, honesty, the non-exploitation, those kinds of things, my top recommendations are Shame-Free Kids by Tina Sellers and the books Sex and Girls or Sex and Boys by Peggy Ornstein. Then I think most of the audience is female, possibly vulva owners. And so my favorite recommendations, if you're having an issue with desire, wanting to have sex, my favorite recommendation is Come As You Are by Emily Nagoski. If the issue is you have a really difficult time climaxing, you've maybe never had an orgasm or just a handful of orgasms in your life, which is maybe my second most common issue I work with couples on. The book I'm going to recommend is Becoming Clitorate by Lori Mintz. If you are an individual who experiences sexual pain and wanting to understand it better, working with a pelvic floor therapist is going to be my first recommendation. If you want to learn more about it at home, though, my recommendation is When Sex Hurts by Goldstein and Goldstein. They're actually not related. And the new updated edition just came out in January. It's fantastic. That's the book I would recommend. Cancer impacts our sexual experience exponentially. I recommend Women, Cancer, and Sex by Ann Katz. And if perimenopause as well as menopause are on the horizon for you, or you're in the thick of it, the best recommendation for understanding those changes, as well as having some real life advice to cope with those changes, is for me, I recommend the Menopause Manifesto by Jen Gunter. So that was like really quick. I don't know, we were hoping to close by 1 and have some question and answers. And so, if you're wanting to know how to connect with me, there's my website, my podcast. I offer online education and support groups for individuals, and I offer online CEs for professionals. So, I know we've got 9 participants here. We've got about 20 minutes left. I'm happy to answer some questions. Maybe Chelsea and I both can answer some questions. I'm going to stop sharing so that we can go back. There we go. So I'm looking through the chat now. I got some ages. And okay. Yeah, really ranging from the late 20s to late 40s. Does anyone have any questions? Or, Chelsea, you want to take that part over?
No, that was fantastic. I really appreciate that. I know it's such a big topic to cover and be like, let's do just a little snippet of everything. It's so hard. So hard indeed. Yeah, I love that you incorporated the books for children. That's something that I think is so important, especially in an area here that doesn't provide very good sex education. And I think there could be more awareness for parents on how to communicate about sex positive parenting effectively to children. And it can be starting with something as simple as consent, like you said, what their body boundaries are and whatnot.
And practicing consent. Do you feel, are you in the mood for a hug? Or I have a very touch sensitive child, and ever since she was little, it was that's too hard, that's too soft. And instead of saying, take what you give, or just don't be so picky, we're learning to talk her language. Like soft feels better. And there are a lot of times, no, thank you. And we're honoring that. Whereas we both came from families that were more of the mindset of give your grandma a kiss, go give your grandpa a hug, go sit on your grandpa's lap. And we're raising our kids very differently and letting them, say, oh, I'd love to give you a hug if you're in the mood. And so that hoping it will feel wrong the first time they're with individuals who don't respect bodily consent.
Sure. I want to circle back to Heather. Initially had wanted to make sure that we covered some normal sex health changes in perimenopause and whatnot. And, you know, the most common one is obviously dryness is the most prevalent, that shift in estrogen, right? And that's where it doesn't mean that there's anything wrong. It doesn't mean that you can't engage in penetrative sex, right? You can.
It doesn't mean you're not aroused.
Doesn't mean you're not aroused. Exactly. I think that's a huge piece too. I think finding that assist with a good lubricant, understanding those changes, making sure your partner understands those changes too. And it comes back to communication, right? I think that's so vital.
And attacking those myths of an erection means you're aroused. Not all erections mean you're aroused, and a lack of erection doesn't mean you're not aroused. It's analogous to lubrication.
Yeah.
Right? There are times biologically that are difficult to lubricate.
Yeah.
Yeah.
I think for women too, another thing, there's a lot of hesitancy I find when thinking about hormone replacement therapy. But the research lately is showing that the connections, as long as family history is clean from, you know, estrogen-based cancers, that there is an okay, it's not harmful per se to integrate some hormone replacement therapy, and adding a little bit of topical estrogen can sometimes be an assist for that tissue integrity, so it's not quite so frail and sensitive. I think that can be an option too. But of course, always.
And I think too, some education there for women that taking an oral estrogen or DHEA or hormone support actually doesn't transfer to the tissues vaginally, and the topicals vaginally of estrogen and DHEA and things like that don't cross the barrier into your bloodstream. And so we actually treat them differently. So you're saying, I'm taking my estrogen, I don't need an estrogen cream. Oh, they're totally different.
Yeah, they don't, it doesn't infiltrate thoroughly enough. Yeah, it really, if we're talking specifically for the vaginal tissue health and whatnot, then you really do need to have the application direct to that area. Yeah, for sure. That was so fantastic. Any other final questions from anybody? Well, thank you everybody for joining me. Thank you, Cami. I know Melody had to run. She had another obligation, but I really appreciate you guys helping me educate everybody. I will have a recording available if anybody wants to catch anything later again, or it was so fantastic that you just want to watch it again. But like I said before, if you guys have any ideas that you want me to do more presentations on, then I'm all ears. But other than that, thank you for joining us on this Saturday afternoon, and I hope you have a lovely rest of your day.
Thank you so much. See you.
Bye.